Hi, my name is Rebecca McComb, and this is my Health Education Intervention Project for Nursing 496. The two health-related problems I sought to address were diabetes and hypertension. I chose these issues because they are prevalent among the community and often poorly managed. One of my classes was called Healthy Eating with Diabetes. I discussed portion control, low glycemic index foods, constructing a healthy plate, and tips for shopping and eating smart. The second class I taught was called Hypertension Prevention and Management. I focused on ways to manage hypertension through salt reduction, active lifestyle, weight reduction, and medication adherence. My overall goal for my underserved community was to improve health literacy through education. I wanted to present this information to the community because I think it's important for people to understand their health conditions and how to appropriately manage them. According to the American Diabetes Association, diabetes was the 7th leading cause of death in the United States in 2010, based on 69,071 death certificates in which diabetes was listed as the underlying cause of death. In 2010, diabetes was mentioned as a cause of death in a total of 234,051 certificates. Prevalence in seniors, which is my target population, the percentage of Americans aged 65 and older remains high at 25.9%, with diabetes or 11.2 million seniors, and these are both diagnosed and undiagnosed cases. For hypertension, according to the Center for Disease Control and Prevention, about 75 million Americans, or 29%, have high blood pressure. That's 1 in every 3 adults. Only about 54% of people with high blood pressure have their condition under control. Nearly 1 in 3 American adults has prehypertension, blood pressure numbers that are higher than normal but not yet in the high blood pressure range. High blood pressure has an estimated cost for the nation of $46 billion each year. This total includes the cost of healthcare services, medications to treat high blood pressure, and missed work days. The People 2020 objective I identified as important to the goals of my project addresses the national health goal of health literacy. It was the National Action Plan to Improve Health Literacy. The plan is based on the principles that 1, everyone has the right to health information that helps them make informed decisions, and 2, health services should be delivered in ways that are understandable and beneficial to health, longevity, and quality of life. One of the interviews I conducted was with Maria A. She is a PA at the Eastside Clinic. She stated that the clinic serves a very underserved population and often people require extensive teaching that cannot be completed in the short time that she sees her patients. She mentioned that sometimes patients return to the clinic with the same complaint but never fill their prescription, either from lack of money or lack of understanding. This led me to the conclusion that poor education that health literacy was a significant problem within the underserved community of Eastside. My experience as an emergency department nurse working for a safety net hospital for the underserved Riverside University Health Systems has given me insight into some of the most mismanaged chronic illnesses out there, diabetes and hypertension. I would see time after time after time people coming in for diabetic complications, for stroke, for a stroke center, and for hypertensive urgency, and based on medication mismanagement usually, and high glycemic blood sugar. So I knew that the community of Eastside would benefit from classes that dealt with these issues. The model used to help guide my interventions was the Precede Proceed model. The model consists of 8 phases. We'll go through the first 4 here. Phase 1 is defining the ultimate outcome. I determined that health literacy and poverty, or poor education and poverty, compounded to increase poor health literacy within the community of Eastside. Phase 2 is identifying the issue. The main issue I attempted to address was health literacy. Phase 3 is predisposing factors that influence health behaviors and lifestyle. Some serious problems for the community of Eastside are poverty, lack of opportunity, and gang activity. Traditional Hispanic cooking is a factor in poor diet as it relates to the two health problems I have identified, hypertension and diabetes. Phase 4 is identifying best practice and identifying barriers to intervention. I had great success with my facility, and the coordinator was happy to have me and willing to help. For best practice, I found that keeping things simple and easy to understand and short were really important for my class. Phase 5 is implementation. The classes I implemented were very successful. The seniors that utilized the Senior Center were eager to learn and actively participated in the classes that I taught. I constructed both classes in a packet form, and we learned together as we went through the packets. The classes were interactive, which helped keep the students engaged. I also created a recipe book by stapling 10 5x6 recipe cards together that were simple, budget-friendly diabetic meals the seniors could use at home. All of the materials for both classes were presented in a previous discussion board for this class and are posted there. Phase 6 is process evaluation. I identified 4 process objectives for my classes. This applies to both classes. So by week 4 of Nursing 496, I was to have a single day volunteer form to be submitted to Marnie Smith, who's the Senior Center Activity Coordinator and personal contact for the Senior Center, detailing the exact dates and times the classes were to be held. 2, by week 5 of 496, flyers were created and set out at Dale Senior Center for both classes. These flyers were used to promote the content of the health classes and to give the dates and times the classes were to be held. The 3rd was content and curriculum for both classes was completed by week 5 of Nursing 496 for both health classes. And 4, a meeting was held with Marnie Smith, Senior Center Activity Coordinator and personal contact, on June 5th, 2017 to go over class content and approve final and get final approval for the content of the class. Phase 7 was impact evaluation. I identified 4 short-term goals for each class. For the healthy eating with diabetes, participants were able to identify ways to build a healthy plate, shop smarter at the grocery store, and eat smarter to gain better control over their diabetes through diet. Give examples of everyday objects they can refer to for portion control, to implement portion control into their diet. So for example, I used, I'll go into that actually in a little bit. So another was to identify healthy foods with a low glycemic index, as well as foods to avoid, and to demonstrate how to read food labels, specifically the total number of carbohydrates and sugars in everyday foods, and describe healthy choices versus unhealthy choices in terms of a diabetic diet. For the hypertension prevention and management class, the goals for the participants were to be able to identify modifiable risks for hypertension, describe signs and symptoms of heart attack and stroke, have the tools needed to identify an action plan for managing hypertension, and demonstrate how to read and compare foods with high sodium levels and low sodium levels in everyday foods they purchase, and identify foods to avoid. Phase 8 is outcome evaluation. I identified a long-term objective for each class. The long-term objective for healthy eating with diabetes was to decrease long-term complications related to high blood sugar levels, such as renal failure, limb amputation, blindness, heart attack, and stroke, by giving participants the tools for healthy eating following a diabetic diet. The long-term objective for hypertension management and prevention was to improve health literacy of the community of Eastside and to help them to understand the complications of uncontrolled hypertension and ways to prevent and to keep it managed. I know the information I provided was important and impactful, but there needs to be reinforced continued education to really have the impact that I desired. So specific behaviors that participants need to identify and or need to adopt in order to maintain the teaching was to actively seek health information in classes, daily exercise, the shopping smart and building a healthy plate handout were really important tools to increase and to help them maintain the diets that we talked about. The skills needed, they need to be able to read labels and understand proportions, ability to coordinate and keep a diabetic diet or a DASH diet, which is a dietary approach to stopping hypertension diet, and ability to understand portion control. Health community services needed to maintain control of these two illnesses are our primary care doctor, community health classes to reinforce education that they receive at the doctor or in the acute care setting, support from family, and exercise support like groups that work together to exercise, which they were doing at the health center. So they were already in the right direction. So for my classes, I'm going a little more detail of what was taught. For the healthy eating with diabetes, I had handouts that I all stapled together. Building a healthy plate, shopping smart, and eating smart. For building a healthy plate, I had a picture of a plate that was divided in one side was half, the other side was divided into quarters, and the half was for non-starchy green leafy vegetables, and the other side was for starchy foods, and then for carbohydrate, and then lean meat. So that was constructing a healthy plate. Then shopping smart, there I gave tips for shopping in the grocery store, like maintaining most of your time along the edge of the store and spending less time in the center of the store, because most grocery stores are constructed with healthy things along the outer edge and less healthy items in the center. And eating smart involved portion control and mainly portion control. But so portion control in comparison to everyday objects, I also gave lots of examples there. For example, I used a deck of cards as a size of a portion of meat, or the size of a woman's palm, or this for lean, like a fish was the size of a checkbook. One serving size of cheese is the size of a domino. A serving size of pasta or mashed potatoes would be a woman's fist. I gave a lot, or like butter was, I think butter was the size of a little, like a thumbnail, or oil was the size of a thumbnail. But I gave those as printed handouts that they could go home and refer to. And talked about foods to avoid, reading labels, low glycemic index foods, which are foods that they would want to eat. And I gave out a booklet of budget-friendly diabetic recipes to try at home. For hypertension prevention and management, we talked about salt reduction in their diet, reading labels, checking blood pressure at home or at a local drugstore if they don't have the equipment there, medication administration and adherence, and the importance of keeping to your blood pressure medications. This is the same with the diabetic diet. Talked about how they need to take their medicine. Weight control or weight loss, increased exercise and active lifestyle. And I talked about symptoms of heart attack and stroke and when to seek their care from their primary care doctor versus urgent care versus emergency care. And I sent that home also as in a packet form or a handout form. So for budget, the budget for this project was minimal. The only cost I incurred was the cost of printing the packets and recipes and the time I invested in planning the project and implementing the actual classes. The Senior Center did not provide any form of budget, and all costs was paid by me. The cost was less than $15, and I wasn't paid for my time. It is neat that all it takes is time and effort to provide a low cost, time, effort, and somebody who has the education in order to provide these type of classes. But it was a fun and interesting experience. So evaluation and outcome measurement. Let's see. For healthy eating with diabetes and for the hypertension prevention and management class, my overall goal was to improve health literacy within the community of Eastside. For healthy eating with diabetes, my main goal was to decrease long-term diabetic complications through tight glycemic control. The short-term and long-term evaluation, or ways that they could be evaluated, is short-term would be after 3 months to check an A1C after implementing the diet that we talked about. Long-term evaluation would be evaluate diabetic complications in 3 to 5 years, although it does take usually 10 years of someone having diabetes to start seeing the ugly consequences of poor control. But I've seen very young people having serious complications, that because they don't control it. So it can happen very quickly also. We all know that. For hypertension prevention management, again, to improve health literacy was my main goal. For this class specifically, decreasing the incident of heart attack and stroke through tight blood pressure control was an overarching idea that I had. Short-term goal evaluation would be to have patients maintain a blood pressure log and evaluate in 3 months. 1 to 3 months, depending on what their doctor wants, and I gave them a handout that was a blood pressure log that they could use at home. Long-term goal evaluation would be to track incident of heart attack and stroke in 3 to 5 years, or comorbidities that are associated with poor hypertension control, and see if people are developing these problems or if they're able to maintain a healthy blood pressure. Results and conclusion, the main points, so the overall goal was to improve health literacy, decrease complications related to uncontrolled diabetes and hypertension, and to provide seniors with the knowledge and tools to live a healthy lifestyle with chronic illness. What could have gone better? I think that if I had advertised my class with more notice, that I would have had an even better turnout, and not during the same time slot as a desired class at the center. My first class happened to correlate with a class that people enjoyed to go to, and so I had less turnout. And I think there was less interest also in the hypertension class than in the diabetes class. People are less scared of hypertension than they are of diabetes in general, although hypertension is pretty serious. Another thing so in my diabetes class it was after a breakfast that the seniors enjoyed going to and socializing with, and many of them stayed together as a group to learn through my class, and so that one was really successful. Future suggestions would be a series of classes that are taught once a week for 4 weeks to cover more information and provide more reinforcement of the teaching. And here are my references. These are all the things that we used. Thank you very much.